Hi everyone, welcome to mindbraintalks. Today, I'm diving into one of the most important forms of psychotherapy, which is cognitive behavior therapy, or CBT for short. Whether you're stressed about exams, dealing with anxiety, or just want a better mindset, CBT could be your answer. So, what is CBT? CBT is a type of talk therapy that focuses on changing unhelpful thoughts and behaviors. The idea is simple. By identifying and channeling your negative thoughts, you can alter your emotions and your actions. CBT helps you to recognize these thought patterns and teaches you to challenge and change those unhelpful thoughts. The process usually involves working with a therapist to identify specific issues and develop practical strategies to tackle them. One common technique is called cognitive restructuring. This involves identifying distorted thinking patterns, such as catastrophic thinking or overgeneralization, and reframing them in a more balanced and realistic way. Another powerful technique in CBT is exposure. This is particularly effective for phobias and anxiety disorders. It involves gradually exposing yourself to the feared object or situation in a controlled and safe manner. Over time, this helps reduce the fear of anxiety associated with it. Now, let's talk about some core concepts in CBT. First, core beliefs or schemas. These are the fundamental principles that we hold about ourselves, the world, and the future. For instance, you might believe that I must be perfect or people can't be trusted. These core beliefs often developed in childhood and shaped how we see the world. By identifying these can be eye-opening, because they influence everything in our mind. Next, cognitive distortions. These are irrational thought patterns that distort our thinking. Examples include all or nothing thinking, where you see things black or white, or catastrophizing, where you expect the worst case scenario. Recognizing these distortions is crucial. Once you spot them, you can challenge and change them. And finally, dysfunctional behaviors. These are actions that reinforce negative thoughts or feelings. For example, avoiding social interactions because you're afraid of judgment. CBT helps you to identify these behaviors and replace them with more constructive actions. Now, how these all work together? Imagine you're preparing for a big exam. Your core belief might be, I'm not good enough. This leads to a cognitive distortion like, if I fail this exam, my life will be over. As a result, you might start procrastinating, which is a dysfunctional behavior. CBT will help you to challenge this core belief and recognize the distortion, allowing to replace procrastination with a more productive action. You can use techniques like journaling, thought records, and behavior experiments to put it into practice. Plus, it is backed by thousands of studies published in the form of several research papers. And CBT works for a variety of issues, such as anxiety, depression, ADHD, obsessive-compulsive behavior, to stress management. So, CBT is a gold standard in psychotherapy and in mental health. Well, it's all for today. If you like what I'm doing, please consider to subscribe to support the channel. Welcome to Mind Brain Talks, and I hope to see you in the next video. Bye!